Dear Black Mommy, did you know that we are at risk? According to the Centers for Disease Control, maternal mortality is described as the death of a woman during pregnancy, at delivery, or soon after delivery. It affects women from all backgrounds, but the Black women are at the forefront of this crisis. The CDC reports Black women are 3 to 4 times more likely to die from a pregnancy-related issue than Caucasian and Hispanic women. Additionally, African Americans have the highest infant mortality rate of any racial or ethnic group in the United States. But we see you, Black Mama. This year, the Tampa Alumnae Chapter of Delta Sigma Theta Sorority Incorporated is shining light on you by spreading awareness on Black maternal mortality through our Dear Black Mommy campaign.
Why is pregnancy more dangerous for Black women? Well, first of all, many comorbidities or many high-risk pregnancies deal with things that are more high risk in Black women. For example, high blood pressure. High blood pressure is more common in the Black population than Caucasian population, other populations. And so when this happens in pregnancy, it can make your pregnancy high risk, and it can make you a higher risk for maternal mortality or a higher risk for preterm labor, which is very important. So one of these things that make us more susceptible, or Black women more susceptible to higher risk pregnancies, is just the nature of the background of you're more susceptible to some medical disorders. Also, another one is heart problems. We have more heart problems, we have more diabetes. And so when you become pregnant, that makes that whole pregnancy risk higher. I think it's so important for Black moms to be an advocate, to make sure you find a position that you feel comfortable with, to make sure that you're listening at all your appointments, to make sure that if you have any questions, that you don't understand something, that you bring it up during that visit. Well, make sure if you're going to an appointment, if there's any questions that you have already thought about or any concerns, make sure you write them down. Many times when you get in the doctor's office, you forget because there's so many things going on, and then you remember later. So you want to make sure everything that's important to you is addressed. The second thing is making sure that when you see a practitioner, it's someone that you feel comfortable with. It's someone that you feel comfortable sharing things that are personal, sharing things that bother you, and also asking questions if you don't understand something. Most important, if there's anything that you feel that you don't understand, it's going to be so important to make sure that you bring that up and you have a full understanding before you leave the doctor's office. Studies have shown us that the best patient care is when you have a good patient-doctor relationship. Preeclampsia. In order to be diagnosed with preeclampsia, you have to have 2 things. The first thing is high blood pressure. The second thing is protein in your urine. The definition of high blood pressure is when your blood pressure is greater than 140/90. Protein in your urine is something we check for in the office, and we have you leave a urine sample, or we have you do a 24-hour urine protein. And if there's a significant amount of protein in your urine, then that's proteinuria, and that's the second part of the diagnosis. It's usually diagnosed in the second half of pregnancy, but most commonly it's close to your due date. It can be diagnosed during labor, it can be diagnosed while you're in labor, or even postpartum, or even when you go home later. Gestational diabetes. Gestational diabetes is a type of diabetes that's diagnosed during pregnancy. Diabetes is described as if you have high blood sugars, but gestational diabetes is a little bit different than regular diabetes, because once you're no longer pregnant, the diabetes goes away. The reason why gestational diabetes is a little bit different is because the placenta, which is what feeds the baby during the pregnancy, has hormones that antagonizes and makes it very difficult to lower your blood sugar. So if you're ever diagnosed with diabetes during pregnancy, it's really important to make sure that you follow a healthy diet, exercise, and sometimes it requires extra monitoring for the baby. Also, if you have gestational diabetes, you're higher risk to develop diabetes in your lifetime. So we screen you at 6 weeks postpartum and every annual exam. Preterm labor. Preterm labor is defined as any birth between 20 weeks and 37 weeks. Now, let's talk about weeks. When you're given your due date, that's actually 40 weeks. So preterm labor is a delivery 3 weeks before your due date. The reason why preterm labor is so important is because it's the number one risk factor or it's the number one cause of newborn death. Also, it's the number one cause of infants going to the NICU. Miscarriage. Miscarriage is defined as any pregnancy loss up to 20 weeks. Most commonly, though, we talk about early miscarriage. So early miscarriage is any pregnancy loss up to 13 weeks. Miscarriages are very, very common. They happen in 10% of pregnancies. That means if 10 people are pregnant, one of those patients may have a miscarriage. And those are only the ones that we actually know about. Some people can have a miscarriage before they even go to see their doctor. So the risk of miscarriage increases as you get older. For example, if you're 35 years old, the risk of miscarriage is up to 20%. If you're 40 years old, the risk of miscarriage is up to 40%. So once again, very, very common. Three most important things to do for your health during and after pregnancy. Well, most important is during pregnancy, number one, as soon as you find out you're pregnant, it's really important to make that initial OB visit very early. Don't wait, because some things can be caught early in pregnancy and we can identify your risk factors. Number two, the second most important thing is making sure you make all your prenatal visits. They're so very important. So even if you're not feeling well or it's difficult to get to your appointment, reach out to the doctor's office because sometimes things can be missed if appointments are missed. Number three, the other thing you can do that's really important after pregnancy is to make sure that you follow up for your postpartum care visits. For example, sometimes we see patients 2 weeks after you deliver because there's high risk for any mood disorders, postpartum depression, bleeding, infection. And then we see you at 6 weeks postpartum just to make sure that you had no other risk factors that we have to follow up on after the pregnancy.
Not say that having a baby is bad for your mental health, but having a baby, being pregnant, going through the postpartum period is a major stressful transition. So just like with any other stressful transition, something like adolescence or retirement, it's going to come with its own set of stressors, and going through a pregnancy is associated with an elevated risk for experiencing mood disorders. Perinatal mood and anxiety disorders are experienced by 1 in 5 women. So that's a pretty high number. That's more than gestational diabetes, more than preeclampsia. And yet we don't often talk about it as a very common complication of childbirth. But it is. So I wouldn't say that it is bad, but your risk is definitely elevated for experiencing something like depression or anxiety when you go through a pregnancy. And then especially for Black women who are twice as likely to experience perinatal mood and anxiety disorders and are yet less likely to be screened and treated for it, it's something that is really important for us to be talking about today. If you have just had a baby and it's, a week in, then you might be experiencing the baby blues. The baby blues are just mood symptoms, kind of mood swings, maybe some sadness, some irritability that's happening within that first 1 to 3 weeks, but it's going to go away on its own. So if what you're experiencing is now you're at week 4, week 5 postpartum, that's a good indicator that what's happening is not going to just go away on its own right now. I need to maybe seek treatment or seek other measures for it. Of course, I'm biased as a therapist. I would say therapy is really great to, protect your mental health. But even before you get to that point, you can do things like attending to your sleep. Sleep is so important, especially if you are a mom. You understand that sometimes sleep is hard to come by. And so just planning that out, figuring out with people in your support network who's going to help so that I can get 4 or 5 hours of uninterrupted sleep, which has a major impact on your mood. I would also say that practicing self-compassion in general is very helpful to protect yourself. If you're able to be as kind to yourself as you would to a close friend and show yourself that kind of loving kindness, and also reminding yourself that what you're experiencing is not unique to you, in the sense that you're not the only one who's having a hard time with motherhood, for example. You're not the only one who's ever wondered if you're really good at this or if you have what it takes, that there are other people who deal with this, because this is just a part of the human experience as opposed to being a personal flaw. So self-compassion is an area that I think can sort of help across the board if you're struggling with mental health symptoms. Certainly things like support groups, talking to friends, people who you can trust, who can also then relate to you and validate some of what you're going through. And then, of course, things like relaxation. Progressive muscle relaxation is great. Box breathing is another one, where you're tuning into your body, because with depression and anxiety, there's a large physiological component to that. So you may notice things happening in your body, especially if you've ever had a panic attack where you're sweating, you're shaking, all of those kinds of things are happening. So that's when it's good to bring in more of that physical stuff, like the breathing and the relaxation.
Well, the word doula is Greek for a woman's servant. We have birth doulas and postpartum doulas. A birth doula supports the mom, gets her ready for birth. Think of her as a coach. She's in that labor room and they're going over techniques to make her labor smoother and her birth easier. A postpartum doula steps in after the mom has her baby, after she and baby are home, and we support the parents. We give siblings, show them how to hold the baby, how to be around the baby. So we integrate their siblings. We help mom out with things like postpartum depression. These doula roles are professionally trained roles. So as a postpartum doula, we are trained to notice when there are problems with the breast or if there's postpartum depression going on. So we're basically there to support and advocate for new moms and their families. Medicaid has started covering doula services, and some insurances have. We have a long way to go, but some insurances do. So I would just ask the new mom to check with her insurance and see if they cover doulas. Teaching the mom that she can advocate for herself. She can advocate for her health, and we are there to give them that support. Sometimes new moms don't think they can do it. They beat themselves up, but we're there to let mommies know they can do it. And we give resources and education to make sure that they can do it.
We walk alongside the mom, helping them find resources in the community that provide services like breastfeeding assistance, also parenting and education classes, classes like how to care for your newborn or how to help your baby get adjusted to a new environment. So those things really benefit new moms. And we also offer services for babies as well, up to age 1. So those services are really important for new moms. Dear Black Mommy, just know that whatever you're doing, especially if it's centered around taking care of yourself and your baby, is the right thing to do. And remember, it's important to advocate for yourself, but it's also important to surround yourself with people who understand the needs of pregnant women and also of new babies.
Dear Black Mommy, I just want you to know that you have many people advocating for you. Myself is one, and many of my colleagues. We all are dedicated to making sure you have the best care possible.
Dear Black Mommy, you can be a phenomenal mother and also struggle very deeply with the transition into motherhood and the demands associated with it. Your mental health matters so much, and you have every right to use your voice to get the support that you need.
Girl, you got this. You can do this. Everything you need to be an amazing mommy is already inside you. And with the right support network, you can handle anything.